Hello, biohacking bestie. Welcome to another episode of the Hack My Age podcast. This is the first episode that we're doing on psychedelics and menopause with Matt Zemon. It was really eye-opening. We talked about psychedelics and plant medicine and the magic mushrooms, ketamine, and he breaks it all down for us because for me it was overwhelming. I'm kind of new to this world, and I know it's big in the biohacking space, and I know it can help a lot of people. So I was excited to record this episode with Matt for you. And we covered what exactly are psychedelics, and are these legal? Are they safe? Are they risky? He talked about microdosing versus macrodosing. We talked about psychedelics mainly for mental health during menopause, and how maybe it can eliminate some other menopause symptoms. Do medical mushrooms affect women's hormones? And how to find safe and reputable sources of psychedelics if you are interested in exploring that world. So before I introduce him, let's see what's going on in the Hack My Age world. So I want to say thank you so much for everyone who is rating and reviewing the podcast. It means so much to me. It really, really helps the podcast grow so we can invite more and bigger guests. So I love you. Thank you. I see every single review there, so I know exactly who you are. So thank you. And if you haven't gone and made a review yet, please go to Apple Podcast or Spotify and just write a little something. Also, if you don't know that there is a newsletter, go and sign up to that. We are drip feeding you menopause information so that it's not overwhelming. I share my favorite biohacks, upcoming events, podcasts that have been released. So go to hackmyage.com. It's going to pop up. I know it's that annoying pop up, but it only does it once, and go sign up. Now, the membership group, Biohacking Menopause, that is growing and growing. I'm super excited about that because we meet more and more of you and we share stories. It's amazing. It's a private membership group. We don't have the Facebook noise. We give you personal attention. And we can't do that in the Facebook groups, but we can do this in this membership group. So I get to know you one by one. So you are welcome to come to that. We have a new member out there, and she's just, I think I must have spent 10 minutes with her. She was glowing and raving and so happy to be in this group and so happy with the information. It was also right after we did a live Q&A, and I also stayed on with her, of course, like I always do with all of our members, and guide them through the process. So I asked her to please write that down because it's so touching, and I want to share it all with you. Now we have live Q&As every week in this group. And today, if you're listening to this today on Monday, September 16th, we have Dr. Jeffrey Gross, and he is going to talk about stem cells and exosomes. You still have time to sign up if you hurry up to the Biohacking Menopause group. The link is in the show notes. And then we also have later on the following week, Dr. Indra Barathon. She's our in-house functional medicine doctor. So we always bring her our labs, we bring her our experiences, we bring her our hormone therapy if we want it, we bring her gut issues, questions, and she is so good about answering all of them. And then after her, we have Dr. Fiona Lovely coming on, and she's got her own podcast called Not Your Mother's Menopause. Go and listen to that. I'll have that in the show notes as well. And she's going to be giving a live Q&A for us too. And again, these Q&As are very informal, and it's just to answer your questions. Honestly, it's to give you that personalized attention. And Dr. Fiona is specializing in brain health. So if you're concerned about brain, Alzheimer's, dementia, brain fog, memory, she is the one to go to. So hurry up and join before the end of the month, because I think she's coming on towards the end, the last week of September. And we also have breathwork classes every month. So if you want to learn how to breathe through menopause, I'm teaching you how to do this. And every month we have a giveaway. So our giveaway this month is Nibu Naturals skincare. I don't know if it's a skincare or serum. I don't know even what to call it because it's so nourishing for your skin, but it's also like a makeup. I call it makeup plus makeup because it uses astaxanthin, that lovely, lovely antioxidant that I always talk about in terms of taking it as a supplement, but now she has this in her skincare. And I'm actually wearing it right now. So if you're on YouTube, you can see I have this glow because I use the bronzer. It's like a bronzer and you just put it all over your face and it's absolutely gorgeous. And she's giving out a huge basket of her serums and skincare and glow stuff and glow to sleep and all this really cool stuff. The draw is going to be on October 1st. So sign up. The value of this basket, I think it's somewhere around $250. It's insane what she's giving us away. And if you just can't wait, or if you're listening to the podcast after that date, you can always go to nibunaturals.com and use the code ZORA, ZORA, for 15% off. So let me talk to you a little bit about Matt. I'm Matt Zemon, and who is this guy? Because we didn't fluff around with an introduction and who he is and how he got in this space. We just went straight into it. So he's an educator, he's an author, and he's a leader in this psychedelic wellness space. And even though he has like the softest voice, he's got such a soft voice. It's like a tranquilizer. He is super passionate about psychedelics and not in like a weirdo druggy way. Okay. He's very focused on how plant medicine impacts our mental health. And he wrote a best-selling book called Psychedelics for Everyone. And he is also wrote the preparation integration journal called Beyond the Trip. And he holds a master's degree in psychology and neuroscience from King's College London. And what he does, he likes to combine his academic insights with helping us understand the difference between safe and sacred psychedelic use and what's not. And he wants us all to understand and access these substances that can be really hugely transformative. And in a way, they kind of sound like hormone therapy. So if you just don't want it, the hormones, like, check this out. So Matt, he also consults with medical practitioners in psychedelic therapy. He contributing his expertise to further the responsible integration of psychedelics into healthcare, right? And his new book, The Veteran's Guide to Psychedelics, will be released mid-October 2024. Now, before we start the show, let's read the fancy disclaimer. Matt, he is not a doctor, he's not a lawyer, and this should not be construed as either legal or medical advice. Go see your own doctor. If you have issues, if you want to try this stuff out, there are ways, and he explains it all to us. So let's start the show. So it's a real pleasure to have Matt Zemon to the show. Welcome.
Zora, I'm glad to be here. Thanks for bringing this to your audience. I appreciate it.
So let's start with an overview. What exactly are psychedelics and what does it mean to microdose? Because I think those two words can be really confusing.
Yeah, I totally get that because when we talk about psychedelics, we're really talking about a class of drugs that historically mean mind manifesting or mind expanding. And it can range from people think about ketamine as a psychedelic, even though it's not a classic. It could be LSD and magic mushrooms. It can be ayahuasca and ibogaine. There's hundreds of other psychedelics that most people have not heard of. So yeah, that is all. When we talk about psychedelics, that's what we're talking about.
It's an umbrella term. And
Hmm.
yeah, and people fear that word a lot. And we're going to talk a little bit about that a little bit later. So what about microdosing? When was that versus macrodosing or normal dosing? What's all that about?
Okay, so when people take psychedelics, there's kind of there's many different ways you can do it. When people talk about going to a psychedelic retreat or a psychedelic ceremony or having a psychedelic therapy, they're typically talking about a large dose of psychedelics that they're going to be in an incapacitated state. They're going to be having this deep exploration inside of themselves. That's kind of large dose psychedelics. When they talk about a microdose, we're talking about like a 1/10 to 1/20th of what that other dose was.
Mhm.
So we think about microdosing as either being subperceptual, such a little amount you don't even feel it, or you don't recognize that it's in your body, or sub-intoxicating, you can still function. It's not taking you down for the treatment duration. Um, and then people do microdosing for a variety of reasons. Um, and then people do macrodosing for a variety of reasons. So they're just two different ways of consuming the medicine.
Okay, let's talk about then why people are doing this. Because the question about a lot of people think, is this legal? Is this safe? Can we just be microdosing or macrodosing ourselves whenever we want? And why? And let's consider countries, if you can, outside of the US, if you even know, it would be interesting to know. So why are people doing these psychedelics?
Well, I think, and especially for your audience, let's talk. I love that question of why. I mean, we're in this really interesting time in world history where we have, as our Surgeon General talked about, a loneliness epidemic. We have people leaving the church. We have people, two incomes in the household, barely making enough to keep the wheels turning. We have so many people on psychiatric medication, whether it's antidepressants, anti-anxiety, mood stabilizers. And for many people, those are becoming effectively lifetime sentences. There's no they get on, but there's no way to get off. And our medical system's not really designed to help people get off. Um, and I
Why?
oh, that's a whole different discussion. I think but what I think people have noticed with antidepressants is, I mean, they only work on roughly 40-ish% of the population. And they come with a huge amount of side effects: weight gain, lethargy, for some people, suicidal ideation, certainly sexual dysfunction in a huge percentage of people. And those are heavy price tags to pay.
Yeah.
So if people are looking for something else, they're looking for something that they don't have to take every day. They're looking for something that doesn't have those side effects. They're looking for something that allows them to look into themselves and remember who they are, and remember why they're here, and to yeah, remember they're connected. So I think that those are the reasons that are driving people towards psychedelics. um
And this is an adult may have some differences than say when you were a teen or you were a young adult, because when we think about mushrooms or magic mushrooms, we think of
mhm.
that high school experience, and people want to trip, they want to have fun, they want to experience. And now it seems as though adults are considering this because they have mental issues, and they need to overcome this, and they need to look within, and perhaps talk therapy isn't enough, or why else? And how is this
Well, I think,
different?
I mean, you get so many women specifically who listen to your show, and
Mhm.
these women, I think, are in their 40s, 50s, 60s. Is that accurate?
Yep.
Okay,
Going
so
through
it's
the menopause
they're
transition. And
going
we
through that
have, and
transition.
the lack of hormones, we know, has a huge impact on our mental health. And we have anxiety, or not everybody, but some women have anxiety, some have depression. We're not able to be, we're not as resilient as we used to when stress happened. So we are looking for other alternatives. And we have the hormone therapy, which can help a lot of women, but maybe some women want something else. And this is where I thought, ooh, it'd be interesting to invite you on the show and talk about how can this help a woman going through this menopause transition?
Well, then let's also talk about what else is happening for many of these women at this stage of life. I mean, for many women, this is their kids are moving in from high school out to college. So for the first time, they're becoming empty nesters. Many of these women are evaluating their relationships with their partners, with their friends, with their careers, and looking at that. Am I happy in what I'm doing? Is this what I want to keep doing for this next chapter of my life? So it's a really interesting time of transition for so many people. w- I'm seeing a lot of people drawn towards psychedelics at that exact phase, which is a very different phase than where we were when we were 18, when we were 21, when we're going into college, when we're in college, when we're just leaving college. Our intentions around why we choose an altered state is different. The attention that we can give it to make sure that we are doing it in a risk reduced manner is significantly different. um, and then I think just we understand more about our biochemistry and why and who we are and where we are, that we want to pay more attention to what we put into our bodies at this
Mhm.
stage of life. Um, so I'm seeing people drawn to psychedelics because they have end of life care. They have an aging parent, and they want to maybe change the relationship with that parent. Maybe they're going through an existential crisis. Maybe they've been through a divorce. Maybe they don't know what to do when their kids have left the house, and they want to call a timeout for a period of time. Even if it's just a day, they want to call a timeout and say, I need to pause. What's going on? How do I feel about all these changes? And what do I want with all of this? And I think psychedelics can help with that. So yes, it can be because someone has a diagnosis. They have depression, they have anxiety, they have OCD, they have an eating disorder, they have a substance use challenge. Great. And for those people with a diagnosis who want to go through a medical model, the legal option in our country is ketamine.
Mhm.
Others, they don't want to talk about the diagnosis necessarily. And they aren't looking for a medical type of healing. They're looking more what I'd call a spiritual type of healing. And for them, it's going to be participating either in one of these psychedelic churches that are all over our country, or going to on a psychedelic tourism experience, going to Peru or Costa Rica or Colombia or Mexico or the Netherlands and taking psychedelics in one of those settings where there might not be a medical promise, but they can have the time to explore. Am I making sense with this?
You are. And yeah, it seems, yeah, it just these two different settings are really different. They're major
Mm-hmm.
contrasts, and it sounds like it's just take your choice. What do you feel more comfortable with? And some people want to feel more connected to nature and want to be outdoors and want to feel safe with other people around them. Other people feel safer going to a doctor with a white lab coat. So it's nice that we do have these options that actually the medical system is starting to recognize that we can use these psychedelics to help people through certain issues in life outside of drugs. But I'm wondering, what is the difference between, we have, like you said, this umbrella, that we have these mushrooms, which I think attract a lot of people because it sounds quote unquote natural. And then you
Mm-hmm.
have maybe LSD. I don't know if that's natural or not. Maybe it's chemical. Is there chemical and versus synthetic? And is there anything different between the two?
We get into a nuanced argument there. And then the argument goes something like this: We are all nature. We are not separate and apart from nature. We are nature. We are living in nature. We might choose to build a building here, but that then becomes nature. So when I think about mushrooms, I think about something that we are able to pick from the ground. It grows in every continent all over the world. They've been using it for thousands of years for healing purposes, but albeit ceremonial and or medical. And that is different than a synthetic where humans have made something like an LSD, but they made it using the wisdom that they've learned and the technology that they've learned and from other compounds that exist. So I think it's all nature, but there's nature that we pick and there's nature that we make. And all of these different psychedelics have different purposes for different people. And I'll give an example. Some people with, and I'll use ketamine. Ketamine is a legal option for people. They can go and they search ketamine center near me, and you'll find someone that is selling a ketamine treatment. They might not, well, we'll come back to that in a second. Those treatments are like 45 minutes to an hour of having the non-ordinary state. Um, and it has kind of a profile to it. Now, it can be used for all sorts of things off label for mental health purposes, and that's amazing. The person who wants that is typically not the same person who wants to do a 5 hour magic mushroom experience, or the person who wants to do a 5 hour ayahuasca experience and go through kind of the physical and that long period of being in that altered state. They're typically different people. They're also somewhat different because some people say, I won't do anything if it's illegal. Then ketamine's your option, or get into a clinical trial.
Is
And
there a
there's others like
difference? Is there a difference in what the outcome will be? Does one work better than the other?
it is everybody is we're all different animals. So there are people who respond really, really well to ketamine. Um, One outcome though that we have seen is ketamine's the efficacy, the length of time that ketamine has made an impact on people tends to be shorter than the efficacy of psilocybin or mushrooms or ayahuasca or even LSD
In the long
um,
run, you're saying
in the
long
long run.
term.
Yeah.
Interesting. S-
Um, yeah.
So, yeah, I keep interrupting you. So go ahead. I know you
No,
had
no, no.
something in your
I
mind.
think that's a great question. I guess I want to say one more thing on ketamine because it is so popular now, and we're seeing a lot of it in the media. There's just so many different ways to take ketamine, all of which are legal, but that doesn't mean they're equal. There are some doctors who believe that ketamine is just a biochemical reaction. So I can go into the clinic, I can get an IV put in my arm or a shot or a lozenge. I'm going to take that medicine and then I'm going to recover for an hour afterwards. And they're going to send me home. And then there's other doctors who believe it's a biochemical, psychosocial, spiritual process. So they want to work in advance. Why are you here? What is your intention? And then they want to put you into a room that's comfortable, maybe with a blanket and an eye mask and some music, and then give you the ketamine experience, and then work with you afterwards to integrate. What did you see? How is that going to impact your life? How do you incorporate it into your life? Both are
That's,
legal and
yeah,
they're
that sounds
philosophically different.
that sounds way better, the second option.
Many people think it's better, but some people want the efficiency and just want, give me the drug and off we go. It's just different philosophies, and it's up to us as consumers to know what we're getting and to ask the doctor, what do you do for me? And then maybe they do all of it, maybe they do pieces of it, and maybe I want to supplement some of those pieces some other way. Interestingly, though, what I just talked about with ketamine are the same questions that really we should be asking any provider. If I go to a ceremony, what do you do before the ceremony? What do you do during the ceremony? And what do you do after the ceremony? Not that there's any right or wrong answer, but it lets us know what do we need to do to supplement, to take care of ourselves for the things that we need in the process.
Mm. Why do doctors now choose ketamine versus antidepressants? And how prevalent is ketamine versus the traditional medications that we have now?
I think in our country, antidepressants are still the first go to for most doctors. That's where they start. What's tough on your listeners is that means they're going to give an antidepressant, and it's going to take a few weeks to get into the system to see if it even works. And then we have to deal with all of the different chemical modifications that are happening. If it's not really working, it's just creating side effects. Then there's the weaning off of it period. Then there's the period where there's nothing, and then we start again. And I would imagine that some of your listeners have been on multiple antidepressants over the last 10, 20 years, which maybe they've worked for a period of time, maybe they haven't worked, maybe it's just been this frustrating process, and that's all normal. I think that's something I don't think is said enough. That if the medication's not working, it's not you failing the medication; it's the medication failing you. And we need another option. We need another tool in our toolkit rather than these medicines that were developed 50 years ago that don't work on more than half the population. I think
Crazy.
it's crazy. It's very, very challenging.
And what's the success rate of ketamine?
It's in the 70s. It's way
Mm.
higher. Yeah, lots of good research coming out. It works in the glutamate system versus serotonin. It's just a different, yeah, it's a different medicine.
Yeah.
And it's mostly off label. There's one exception. There's a medicine called S-ketamine that Johnson and Johnson went through the FDA process. That's the only one that's legal for truly legal or approved, I should say, for mental health purposes. The others are used off label for mental health, but that's still legal. It's just a different purpose, and that's very common in medicine.
Mm. So, yeah, then I guess it sounds like there's a lot of work to be done still with getting doctors up to speed with the ketamine, because it sounds like there are much fewer side effects, which is super important. And what about when someone's on an antidepressant, they have to wean themselves off, and that can take a really long time. So,
Long
what
time.
about ketamine? If you say, oh, I want to try it, see if this works, is there a process that they just have to wean themselves off as well?
No, there's none of that with ketamine. People typically come in. The typical protocol is you're going to do 4 to 6 ketamine sessions in a tight period of time, maybe in the first month.
Hmm.
And then after that, they're going to see how long you can go before you need another one. For some people, it's months. For others, it's weeks, but it's certainly not every day.
Hmm.
Um, and they try to stretch that out as long as possible. And then again, I guess the other thing to remember is all of these things were originally developed to be episodic treatments. Even antidepressants, they were never meant to be a 10-year, 20-year solution. It was, I'm feeling this way. I'm experiencing this now. Help me get through this. Help me stabilize. Get me off of this so I can then move forward. It's just not how we do it in our society. And I think with ketamine, it's very similar. I need to stabilize. Um, I need to show myself some things so that I can change my mindset from the inside out. And then I want to stop taking them.
Hmm.
And I think it's very possible with the ketamine.
You'll like to hear that when I did my Master's of Gerontology, we had
Hmm.
a fabulous class called the Mind-Body Connection. I absolutely loved it. And this is a
Mm.
USC, a research-based university. So I was like, oh, cool. This is interesting. And that was The second time I heard about ketamine, the very first time I heard about it was from Sean Wells. He's a biohacker. I don't know if you know him, but he's the first person I ever heard about ketamine. And then when I heard it repeated in the gerontology program, it was amazing because usually in gerontology, they don't know what's going on in the biohacking community.
Hmm.
They're actually kind of behind. I had to teach the professors some things myself. I was learning at the same time, but it was really interesting to see ketamine pop up there as well as an option to help people through the mind body connection and it was all about stress and the stress response. So that's really promising, I think, in terms of this being something that is a great alternative to the antidepressants. The next question I have that came up was because you mentioned different methods of delivery of all
Hmm.
of these. And so I'm imagining magic mushrooms, you're eating a mushroom, or if you're taking an antidepressant, you're taking a capsule. It just shows you how naive I'm about all this stuff, which is why you're here to educate us. So, what are the methods of delivery, and is there one that's better than the other?
Um, there are methods of delivery that are more consistent because the what's called the bioavailability is clearer. With ketamine, there are many ways you can do it, but typically people are either doing an IV, they're doing a an intramuscular shot, or they're taking a lozenge. That's or a nasal spray. Sorry, those are the four primary ways. There are other ways to do it, but those are the four primary ways. The bioavailability of an IV is much higher than a lozenge. So it's easier to dial it in than it is. On the other hand, a lozenge is something that people can do at home with a sitter, and there's a convenience factor for that. So typically, it's not where you start unless you work with one of these telehealth companies, but it's something that after you've done a few ketamine sessions, you can go home and do self-administered ketamine. Super convenient.
Is that
When we
prescription
talk,
only? I'm assuming, no,
it's
ketamine?
prescription only. Everything we're
Yeah.
talking about is ketamine. So the issue, and let's so that we talk about Matthew Perry. We can talk about there are people. The challenge we have with ketamine is of all the psychedelics, this is one that has shown more addiction potential in animals than other psychedelics. Most psychedelics are non-toxic, non-addictive. Ketamine can be addictive. So it's super dangerous to do ketamine on your own without using medical supervision. There are people who they take a little nasal spray at a party or a powder at a party of ketamine, and all of a sudden it quickly spirals into they're taking more ketamine each time to achieve the same effect because our body adjusts relatively quickly to the ketamine. And again, it has shown some addiction potential. So please, with ketamine, I would be super careful. With a doctor, great. There's really been no signs of abuse with under a doctor's care. Outside of that, it can spiral quickly.
Hmm. Yeah, we should probably
Method.
remind everybody if you want to explore this, please go talk to your doctor first. We're not condoning everybody should be doing all these psychedelics and do them on your own. It's just for informational purposes only. Sorry, I had to
That's
put
also
that
true.
in.
Yes, put that out there. Method of delivery. I'm going to switch to mushrooms because so many people are taking mushrooms. There's actually, and I'll recommend there's two groups that your audience might be interested in. There's a book called The Psilocybin Handbook for Women by an author named Jennifer Chesick. And this is a book written specifically for the unique um, things that women deal with when it comes to mushrooms. So I think that book might be of interest. And then there's a group called Moms on Mushrooms that Tracy T runs, and she's a lovely human and has done really good work on educating and saying, "Hey, I'm a taxpayer, I'm a mom, I'm an educated person, and I do mushrooms from time to time." And I think their organization is great, and saying we deserve to have an option that's different than the big pharma option. Um, so mushrooms, yeah, you can eat the mushrooms. They grow all over the world. Typically, people dry them and then chew on them. You can grind them and put them in capsules and take them as a pill. Many people put them into an orange juice or a lemon juice and let them sit in the juice for 20 minutes, which gets the enzymes breaking down before they drink it. Some people make it a tea. Some people will put it with like a cacao, like a hot chocolate. So there are lots of different, and then there's chocolate bars and gummies and all sorts of things for mushrooms. So many different ways you can take mushrooms.
Is that legal? And where do people buy these things?
So we have clinical trials going on in multiple locations across our country. Many academic institutions are studying mushrooms. And if you can get into a clinical trial, that's a way to do it legally. Outside of a clinical trial in our country right now, it's basically people doing it underground, either through
Mhm.
different psychedelic churches. There's somewhere between, I don't know, 200 and 750 psychedelic churches in America. It's a big number. So they maybe found one of those. There's a
And
number
these
of
are these are not
therapists.
these are not religious affiliation as well. Like if you're Jewish, you can still go to the church, or they just call it church, or do you have to be of a certain
It's a
denomination?
lovely question. No, so most of these churches are non-denominational, and but they are truly believing this is their sincere religious belief that they believe that they use these entheogens is the term that they use for psychedelic used in a sacramental purpose to connect with spirit, to connect with the interconnectedness of all things, to remember that we are spiritual people having a human experience. So that's all very religious, and most of them it's people come here for come to a ceremony for that piece of connection, direct spiritual experience, and then return to their faith traditions.
Hmm.
And then we're seeing groups pop up. There's one called Ligare, which is Christians and psychedelics. There's one called Shefa, which is Jews and psychedelics. There's a Muslim organization with psychedelics. There's Buddhist organizations with psychedelics. There's lots of I went to I went to a conference of spiritual leaders, and there were representatives from Methodist, Presbyterian, Quaker, Unitarian, Jesuit, Episcopalian. I think who else was there? It was all Christians and psychedelics. It was fascinating to see how they are thinking about using these tools for themselves. How do I become a better pastor, a better spiritual director, a better leader in my community, and for our congregations? How do we have a member who's in the process of dying, and they're using psychedelics? Maybe when their friends and family who are witnessing that transition use psychedelics, how does that change that relationship? How does that change that last period of time on this planet? In my experience, I've seen that time and time again, where it not only changes it for the person who is transitioning, it completely allows healing and conversation and love between the people bearing witness and that person to occur. It is I think it's one of the most beautiful things that I see regularly in this space. And there's amazing research being done from Johns Hopkins, from Yale, from University of Southern California on the use of mushrooms for end of life distress. And now we're starting to see it, and for if not just for that person, but for their friends and family. It's incredible to watch.
Interesting.
Mhm.
Why don't we talk to the audience about a journey? What does that look like if somebody says, I want to go and do some ayahuasca, or I want to go do the ketamine kind of thing? It sounds like you explained that already. People can go and they get a shot and then they have an hour session and they get their therapist to talk about whatever. But what's
Mhm.
going on the
Mm.
other side if somebody wants to be more in nature, be more grounded? How, and you said it's a long 6 hour thing. What does it look like if somebody says, I want to try it that way?
So there's it's going to depend on the practitioner that they find. So there again just different philosophies. There are some practitioners, I'll use mushrooms as an example, who you're going to go and they will tell you about the mushrooms. They'll maybe put on a playlist of some sort and give you an eye mask, and you'll do your journeying. There's others, like a lot of the ceremonies that I work in, where we have live musicians there, and they're creating a kind of a custom soundscape based on the energy of the room. And that's actually borrowed from like a Shipibo ayahuasca tradition, where it's almost channeling. There's no playlist. It's what does the room need to hear now, and let's make sure that's what's being played. Um, I love
Cool.
ceremonial psychedelics because it gives the message, the overarching theme that I've seen is it's mostly about love, and that we are spiritual creatures having a human experience, and that we are at our essence worthy, and at our essence worthy of love. And then we can unpack whatever stories that we've put on top of that. What programming did our parents and our teachers and our government give us? And we can see all that stacked up. And then with that realization of, oh, wait a minute, I am worthy of love. I am beautiful. I don't need to think about this the way I've been thinking about it, or I'm living over here in a scarcity mindset, and I really can think in an abundance mindset in a different way. Okay. And now I can implement that into my life. So I think ceremony gives space for those things to happen. And unlike therapy, where I'm going to meet with you, Zora, and be like, okay, let me bring this out and talk to you about, have you thought about this? Have you thought about that? Let me give you a technique. This isn't about that. This is about having the time to have inner knowledge come forward from the inside out. And then you become awake, you become aware, and then you know what to do. And you don't need someone to tell you.
Mhm.
And I think that's a beautiful healing modality that we don't practice enough in a Western culture. And with these medicines, we can.
So if somebody says, I'm going to join a ceremony, so I
Mhm.
understand this can be a full day thing, it can be a 3-day thing.
Yep.
They get their forms filled out, they have a little bit
Hmm.
of reflection. Some people do a diet, some people like to detox, and then
Hmm.
they go into this thing. I've heard about ayahuasca and iboga, and it doesn't sound fun in some ways because I hear you're throwing up because you're taking actually kind of, what is it, like frog poison, or I don't know what it is, something. And then you have this journey, which is
Hmm.
mind blowing. Everybody I know who's
Hmm.
done it has just been blown away. And then you come down and then you have this reflection and you can talk to other people about it. You share. I mean, I just understand that, but is this the way it is with all these different types of plant medicines? And again, I am saying plant medicine. Is that the same as psychedelic and mushroom? And
Yeah.
am I mixing
In
up
this
words?
case, it is all the same. When we're talking about ayahuasca, that's a vine and a bush that's boiled down together to make a brew, and you drink it. Plant medicine, absolutely. Mushrooms, plant medicine. Even if it's a fungi, it's still plant medicine. Um, what you are bringing up, what's coming up for me as you're asking these questions is really the importance of anyone who is thinking about doing these types of journeys, to ask questions and make sure that they are doing it with a responsible person. And what Johns Hopkins research says is there's three things to pay attention to: source, set, and setting. Source is, where did the medicine come from? If you're doing ketamine, it came from a pharmacy. Okay, we know that. If it's not from there, do you know that this practitioner buys or makes pure medicine? That's worth asking. If they do this as their everyday job, they probably do. If they do it every once in a while, or they just bought it off of Instagram to host some people at their house, you don't really know where that medicine came from. Set is your mindset. Are you doing this because you want to do this? Or are you doing this because you want to please somebody else, or somebody else has asked you to do this? Um, your mindset is, are you clear in your intentions? This is what I'm trying to get out of this experience. This is what I want to learn. This is what I want to see. Um, Mindset is, are you comfortable with, I trust this practitioner that they're going to take care of me and they're not going to take advantage of me in this space? All that is your mindset. And then setting is the physical environment. Are there going to be kids or dogs or Amazon or neighbors coming by? Do you have control of the music? Do you trust your fellow travelers who are in ceremony with you that they're going to be respectful of your process? Do you have multiple people who are taking care of you so that if you need to go to the bathroom, you need a water bottle, you're scared that you know that they're going to help you through it without crossing any lines. Um, those are super important things to look at with this. So then once you have those things, you can then say, okay, I was just with a group of veterans in Peru, who they chose ayahuasca. They wanted a really physical experience where there's purging involved, and um, it's an all-night ceremony. And in that case, it's 3 nights in a row of these ceremonies. That's what they wanted and in their case, they were mostly working with PTSD and traumatic brain injury, and that's the kind of experience. Others, I want a more loving experience. I don't really want to purge,
Who
but I
wants to
do want to.
purge? I don't know why. That
I
just doesn't
didn't.
sound
It
attractive.
doesn't sound fun, but it's actually not. It's not in the context of what you're doing. It's actually quite beautiful. And I know it sounds so weird because I don't like doing it, but it's it's different. There's always a message in the bucket. It's interesting.
Is it a
Mm.
better outcome? You go, okay, I got to purge. It's going to be painful, but I will get a better outcome if I do.
You don't have a choice with the when you're taking ayahuasca. There's no like, oh, I'm gonna hold back here. If the medicine wants to come out, it's coming out, one
Yeah.
way or the other. What I find is in the medicine experience with ayahuasca, when you do purge, there's some type of thing that becomes clear to you as you're purging. It's like, oh, that was my message. I got it. And then once, for me at least, once I purge, typically once, maybe twice in an evening, I can then go through the rest of the night without purging again. Um, but not everybody has that. Mushrooms, you're not purging for the most part. There are a very, very, very small amount of people who have nausea with mushrooms. But it is gentler on the body. There are many mushroom ceremonies that take place during the day, so it's not all, it can be an overnight, but it doesn't have to be. So as we're getting older and we have back pain and different things, and we're not used to staying up all night, mushrooms can be gentler. And then the other medicine we haven't talked about today is MDMA or MDA, but MDMA is getting a lot of press with the use for post-traumatic stress disorder. It's more gentle than ayahuasca. Some people have headaches. Some people clench their jaws and their fists with it, or different body parts.
It's a
But
plant medicine or
it's a
synthetic?
synthetic. MDMA is a synthetic. MDA is kind of in between. But MDMA was known as like ecstasy when we were kids. But
Okay.
with very pure MDMA, it's very specific doses. It has tremendous um, efficacy for, on one hand, it's groups like veterans, first responders, victims of sexual assault. It turns off shame, blame, and guilt, and then
Mm.
allows us to process whatever it is that we want to process without those emotions. And so we can look at our role in whatever it is we're looking at. Um, and that's really quite lovely and quite powerful for people. And to say, okay, I see what I did, and I see that I wasn't responsible for this and I was for that, and no bad me. I will move forward with a new awareness, and they can move forward.
Like you
We
can let
really did.
go, like because
You can let it
mentally, a
go.
lot of people know I just need to let go, but it's so easy, much easier said than done. So you're saying
Hmm.
that the journey helps you let go
It
without
makes it,
an
yeah,
effort.
100%. Yeah. The example I
Cool.
give with this is I was on a journey where I had some inappropriate sexual contact with a family member 10 years older when I was a young teenager. And on one of these journeys, I was right back in that place. I didn't want to be back in that place. But they teach us, when you're working with these medicines, if you see something that scares you, you need to become the anaconda. You need to go into the dragon's nose and look out through the eyes. So in this situation, I just said, okay, what are you here to show me? And in this case, I was able to look at this person. This is 30 years later. I was able to look at this person and be like, okay, I don't condone what you did, but I can understand how lonely you were. I can understand how many things were going wrong in your life. I can understand that you were dealing with substance use challenges. I can understand that you were feeling rejected here, there. And can, without condoning the behavior, I could understand the humanity. I could understand that I wasn't the adult in the room. I could understand that it wasn't anything for me to be ashamed about. Um, and in an instant, this hole in my heart healed. And
Wow.
again, I carried that for, yeah, more than 30 years. And then in a 4 hour, 5 hour session, it was gone.
And you could talk about it in
And now I can
public
talk
right
about it.
now on a
Yeah.
podcast. I mean,
And
that's
before, if you
amazing.
even made a joke about something like that, my ears would burn. I'd get this little pit feeling in my stomach. And
Yeah.
now I can talk about it freely.
Oh, 30 years. I'm sorry. Just carrying that. Just horrible. Wish you found it all before.
Yeah,
But here
this
we
was late in
are.
life. I was in my mid 40s when I found psychedelics. I mean, I was not a drug user, not a big drinker, and
It's
it's been
crazy.
quite the transition. Hmm.
Well, let's speak to the woman who's going through this menopause transition, and you are in your 40s, 50s, and we're carrying a lot of baggage. I mean, I'm just that's life. We do have stuff that happens, and
Hmm.
that's normal that we keep it in, or we're trying to get therapy, or we go on antidepressants, or that's just the way it is. So this seems like a really interesting possibility. The only thing is that whenever I hear about plant medicine and people's journeys and what they see and what appears to them, it sounds very much like holotropic breath work. And
Mm,
when you get into this other state of mind, it's it sounds so similar. And I know people going through their own journeys with breath work. And I've done some breath work journeys and I was blown away. My brain can actually go
sure.
to a different level. I was I couldn't believe it. And I've seen a lot of people go through these things. I've done several journeys, and it's always different every time. And but what I'm thinking is, well, when it compares to something like taking a substance and putting it in your mouth, I think, oh, well, I'm more comfortable right now using my breath. It's free, and I probably could use it for a lot of other things as well. I'm a breathwork instructor, but only for functional breathing, not that kind of stuff. So yeah, I understand you do need to be with an instructor. You have to somebody watch
Hmm.
you, somebody, because things come up. So what, in your opinion, is the difference? Is there a huge difference in the outcome of what when people are trying to resolve their issues?
I love this question, Zora. I think people are drawn to different things. Holotropic breath work was developed by Dr. Stan Grof as a way for him to continue his exploration into non-ordinary states of consciousness once his research, I think in this was the early 70s, got shut down with psychedelic medicine. But he had done a ton of work before developing holotropic breath work. Super powerful. Typically 2 hour experiences in my experience, and you can get to a non-ordinary state. Um, and for many people, they can have huge experiences, insights, all sorts of things. And if that's something that people are drawn to and they want to go there first, you can be on antidepressants. You can, it's a great place to start, and it's a great place to experiment with. And for some people, it's all they need. Others are drawn towards ayahuasca or psilocybin or iboga or again these other MDMA, and they feel like they want to go that direction. And I think all of it needs to be available. And then I also think that we use these modalities as ways to connect and to remember, and sometimes we want to do that with a medicine and a guide, and other times we want to do it with our breath. And all of it can be done in conjunction with each other. I think the breath work supports the medicine supports the breath work, and yoga supports, and there's all
Mm.
these other tool, and running and sleeping well and eating healthy. It's all part of the same family of how do we optimize our human existence, and then as part of that optimization, how do we optimize our spiritual existence?
Cool. We have options.
We have
Let's,
options.
yeah, let's talk about the menopausal woman then. Let's going through this transition. What is, so I can understand now, I can see how this can help women with anxiety and depression. It's quite clear. But what about other symptoms that she may have, like brain fog or joint pain, hot flashes, low libido, sleep disruptions, vaginal issues? Like, is there anything else that the psychedelics can do to help her with her symptoms?
Yeah, I really do like that book from Jennifer with the psilocybin handbook.
Oh, okay. We'll have to
It's
put that in the
not
show notes.
put that in the show notes. I mean, it's no surprise that I don't think it would come as a surprise to say that the research for women's based issues has been less than desirable. Um, it's an unfortunate state of our medical system today. We don't spend as much time here. There are small studies. There are certainly case studies of different things here specifically for women, but no large trials and studies that what you can point to and say it does this for that. That being said, the question part of the I think it's fair to say that part of what causes menopause is certainly chemical and the symptoms, and other things around it is also can be environmental, can be related to all the other things we've talked about: career, partners, children, transition, next chapter, aging
Biopsychosocial.
parents, biopsychosocial. um the psychedelics, what they do is they break up repetitive thought patterns in the brain. So that's why these work with everything from autism to substance use to depression. It seems to me that for anyone, including women who are um, getting into thought loops and thinking about this over and over, thinking about the same thing in the same way and looking at the relationship this way or that way, breaking them up for a period of time, allowing neurons to fire that haven't normally fired or haven't fired together in a long time, reminding ourselves that, oh, wait, I don't need to ski on this track. I can ski down the entire mountain. How do I want to ski the rest of my life? Is powerful. And what's causing the low libido? Could it be chemical? Absolutely. And it could also be maybe the relationship's not what we want it to be. or maybe I'm not prioritizing uh, this part of my life because I'm over prioritizing that part of my life. And I think those insights come to everybody differently. And that's again the power of this medicine. It's not a one size fit all. I actually say all the time, psychedelics aren't a cure for anything. They're a catalyst for awareness and for awakening. And that changes from person to person. But it's
Sounds
not the
like hormones.
drug. Sounds like hormones that they're
Yeah.
not the same for anybody.
Yeah, when we give hormone
Mm-hmm.
therapy to women, it's never one size fits all. So it sounds very
Mm-hmm.
similar. Everybody's absorbing things differently. People react differently. Some people need different dosages, different
Mm-hmm.
methods of delivery, and it sounds very, very similar. It's just a matter of maybe, uh, quote unquote, playing around with it and trying to figure out which one works with you, obviously with the guidance of some professional. But you've certainly given us a lot to think about. And I really liked the message that you had. I was listening to you on Sandy K Nutrition's podcast. It was
Mm-hmm.
great.
Thank
And
you.
yeah, you mentioned how psychedelics can help couples reconnect. And I thought that was a really cool thing because we've been talking about our own experiences, our own journey, internal, what we see, but how can a couple be using this together to reconnect?
So that's I love that. There are I didn't know this existed. There is a lot of work being done with MDMA. There was before it was outlawed in 86 or made illegal, rescheduled. It was used in couples therapy pretty regularly. Um, what we're seeing with MDMA again, you turn off shame, blame, and guilt. We call it a heart opener, an empathogen. So we've now increased the love that we feel for ourselves. We feel the love that we're able to give others, and we've turned off shame, blame, and guilt. So then, Zora, you and I can have a conversation where I say, Zora, I love you so much. And when you do this, I feel this, and it hurts. And instead of getting defensive and saying, well, that's because you didn't do the dishes or because you didn't do that, you can say, I hear you and I love you so much. I don't want to hurt you. And I understand I didn't see it that way. And I get it. And I can see this differently. And with both people in a relationship having that discussion, defenses down, love up, a lot can be accomplished. And that's kind of a different type of psychedelic experience versus the individual, even if you're in a group where you're just working yourself self and being quiet. This is more of conversational between in the relationship. And a good facilitator can help will know when, okay, stay in the individual, stay by yourselves. Okay, now come up and speak to each other. And they'll know when to do that. And it's powerful. I know a number of couples who once a year they make MDMA part of their ritual. To just make sure they're communicating at that level of depth because we all get lost in the day to day with kids, work, uh,
Amazing. Yeah. I think
stuff.
it's so cool because if you've been in a marriage, let's say 20 or 30 years, I'm sure you've had a lot of ups and downs with that person. I mean, if you're still around too, hopefully that, it's
Hmm.
worth it. But if I'm sure there's stuff that's going on. So it's always good
Hmm.
to get back and reconnect anyway, whether it's through breath work or the MDMA. Sounds pretty interesting. I love that. I think that's a really cool thing. So I'm gonna have to let you go, but we're gonna have a very short answer if we can
Okay.
for this one. The question is, do psychedelics sorry, let me start again. Do psychedelic mushrooms affect a woman's hormones?
My short answer is maybe. We can't, I don't love pointing to medical answers that's not backed by research, and we don't have enough research there.
Mm.
What I do know is they can affect women in these major life transitions that come around menopause. So whether it affects the hormone directly, and that's the mechanism of action, or whether it affects all these other areas of awareness, insight, um, false narratives, um, it can make a huge impact on women going through menopause.
We need more research. Yeah, I don't know. Is estradiol and progesterone,
And it's
testosterone going to be
happening.
affected? We don't
Yeah.
know.
It's just not.
Cortisol, very likely. We can probably
Yep.
take a
Yep.
good guess that that's being affected. And then, of course, all the other hormones. I'm sure it's being affected somehow, but how we need more research, right?
Yeah, I do know that Jennifer goes into she, in her book, she talks about some of the research that's out there and very specifically what they think is being impacted. But she's also careful to say, this is, we don't have a lot of research on this. So
Mm.
These are thoughts, these are anecdotes, these are cases, these are small samplings.
I got to read her book. Sounds really interesting. Maybe even get her on
Hmm.
the show. Do you know her? Can you
Yeah.
connect me?
Yes. Yeah, let's follow up afterwards.
Cool. So if anybody wants to find out more information about Matt Zemon and what he does, go to mattzemon.com. That's Mattzemon. And who is the kind of person who should not be exploring
Mm.
psychedelics?
Yep. So I'm going to quickly endorse. There's a website, spiritpharmacist.com, a guy named Dr. Ben Malcolm. If you have unique medical, um, or if you just an objective third party to look at your medical background and tell you the risks associated based on your prescriptions, your supplements, your age, your medical history, spiritpharmacist.com is a great place to go. There's another one called Dr. Emily Culpa. She's a great place to go. But if you're schizophrenic, this isn't the right medicine for you. If you're in an active state of mania with bipolar, it's not the right medicine for you. Um, if you have, if you're taking different medicines, there are psychedelics you can take, and there's others that are dangerous. The quick example would be you can take an antidepressant with ketamine or psilocybin pretty easily. You can't take it with ayahuasca. So knowing what you're taking, MDMA, dangerous with antidepressants. So just be aware that not all medicines, not all psychedelics work with whatever medicines or supplements you're taking. Working with someone like a Dr. Ben Malcolm can help you decide what path you're going to go down on the psychedelic journey.
Before I let you go, do you have any last words for a woman going through the menopause transition?
Our medical system is not telling you everything that's available to you because it's not available to them. If you're going through menopause now, you were probably born in a similar time period as I was, and we've grown up our entire lives in a prohibition. So all of this programming about all drugs are bad, they're going to fry our brains, they're going to lead to addiction is all that we know. So to be scared of this is natural and is of course there are options. There are ways to do this with reducing risk. There's ways to do this responsibly, and it takes intention and attention to do it. And there are other options out there that can help with these major life transitions, including the menopause transition you're going through.
Get his book, Psychedelics for Everyone. It's also on his website and Beyond the Trip. I'll have links to the show notes in that. And he has a free guide to microdosing. And
Mhm.
and that's also on his website, mattzemon.com. Links in the show notes. He's got the email, LinkedIn, Instagram. He's all over the place. Perfect. Well, with that, I'm going to let you go. Thank you so much for your time, Matt. And I hope to see you again.
Zora, I really appreciate this conversation. You have a good rest of your day. Enjoy Spain.
Thank you.